name is Austin Garcia. This is for the critical assignment for Foundations in Kinesiology. The profession I did choose was the physician assistant profession. This profession, I have been pursuing this profession for a year and a half already. I'm working on the prerequisites along with my major at this moment. I chose this profession because when I exited school from as a medical assistant, I did. That's when I first encountered working with other healthcare providers, such as nurse practitioners, medical doctors, and other physician assistants. That's where I really found my calling in health, which was in healthcare, and I enjoyed my position. I really enjoy working with patients and work just seeing I've seen many things, of course not everything, but I've seen a lot of things and just being a medical assistant. I want to pursue this. I want to learn more. I want to expand my knowledge so therefore I could be a healthcare provider. Physician assistant is kind of the way I've always wanted to go. Opposed to being like a nurse practitioner or a medical doctor. Nurse practitioner would have been a great idea if I pursued nursing. However, I wanted to pursue more of a medical model rather than a nursing model. And as for a medical doctor, I didn't really want that responsibility of having to be always on call for patients. I wanted that kind of liberty to work with patients, but not be as committed as a medical doctor. Of course, I'm going to be committed to my patients, but I wanted that liberty to expand. I wanted to keep my options open in case. Of course, always want to keep busy. I always want to keep busy, but I don't want to be consumed as a medical doctor would. Um, some requirements that the school requires that, at least in California, they require at least a bachelor's degree. So it is a graduate course or graduate program. So it is typically it's a 2-year program. A school that's an exception to that is the University of Southern California. Their program is a 3-year program. However, usually they're 2 years, including with California Baptist University. Um, so the requirements to enter the program are obviously the prerequisites on physiology, microbiology, chemistry. Trying to think what other ones. Hmm. Other courses are things like medical terminology, courses like that. They also require background experience. In my case, medical assisting would be suffice because I have worked on hand with providers along with patients, and I'm hoping that suffice for these programs. However, they accept experience from all other fields, EMTs, nursing. A lot of nurses actually become physician assistants and things like that. The difficulty getting in these programs is that there are so many applicants and there's so little seats. I know with the California Baptist University's physician assisting program, when I went on to the information session, they were stating that they last year at least they got 2,000 applicants and there were only 30 seats. So it's very competitive to get into these seats because everyone, or not everyone, but many people want to get into this program. So that's just unfortunately how it's just very difficult to get in. My qualifications obviously is my background experience working with patients hands-on as a medical assistant. I have been medical assistant for about almost 2 years now, and I really do enjoy it. I can honestly say it is my passion. It's not just words. It's legitimately my passion. I I have worked with I've worked at urgent care, family practice, and I really love that combination. I've seen things from lacerations, from just basic common colds, and I've gotten to take those vitals, report to the healthcare provider so they can be treated by the healthcare provider. So I want to pursue this career in the sense of just wanting to be the healthcare provider. I want to treat them. I want to I want to diagnose them. I want that responsibility and I want that knowledge to be able to do that. I feel like I'm a good fit because I'm very passion on treating. I want to help people. It's very rewarding when patients come back and they say thank you. And sometimes they don't say thank you. Sometimes, they're too ill to say thank you. But knowing that I have made a difference, it's honestly the best feeling. Because when they leave or sometimes they'll call back or they'll call and they'll say, thank you. Thank you for getting this done. Um, I know things are hard. I know things, I'm not the only patient, but thank you for helping me in my time. And honestly, that's the best feeling I've ever felt in my life. It's no, it's very rewarding. This in healthcare at least. So that's a big reason why I feel like I'm fit for this position because it's my passion. Not only is it my passion, but I'm ambitious. I want to know more. There's no limit for me. I want to know more and more and more, and I just want to absorb everything I can. I want to be useful. I want to be versatile. I want to be able to just treat the world, but of course that's impossible. But I want to be able to treat as many people as I can efficiently and be the best I can for one another. Um, I want to be hired. A reason I want to be hired is because I, as of course as other applicants are going to be, I want. I know I can do the best. I know at least I can do my best. And with my experience, with my determination, my ambitions, and my passion, I know those are the key elements to doing great in this career. And I just hope that I get the opportunity to do so one day. Um, a Bible verse that really stuck with me throughout this course was 1 Peter's 5 through 7, releasing all situations to God, whether it be people, situations. I just to leave it to God. Let God decide the course of action. We get so consumed on controlling everything. We want to control. We just want to know everything, and we just sometimes it gets very stressful trying to keep that all to ourselves. And I think hearing that Bible verse in week 7 actually, it did. It was I got a sense of to let go of all the anxiety, let go of all the stress, and kind of give it to a higher power, which is God, and let it. Don't think that you're alone. Think that there's always someone, God, who's with us, and leave. Don't depend so much. Don't think so much on little things because at the end these are all tiny obstacles. They're meaningless because the only thing that matters is our devotion to the Almighty Father. So that this reading was very enlightening because especially in these last 8 weeks it's been very stressful and along with personal life, work. So that was a very refreshing feeling just to know that there's a higher power out there and we all need to remember that at the end of the day. Thank you so much, and I hope you have a great night. Thank you.